Good afternoon, Eddie.
Good afternoon, Governor.
So I'm delighted to present a basketball mask with a basketball design on it. This is presented by what they call the Three Masketeers that was sent to Dr. Smith that have made masks. They've made 1,977 masks given to various groups across the state, from UAMS Housekeeping Department, Arkansas State Hospital, Centers for Youth and Families, and a whole host of other nonprofits and nursing homes here in Arkansas. So we appreciate good citizens, and they also sent me especially this basketball mask that I'm very proud of. And Dr. Smith, thank you for providing that to me. Secondly, I wanted to recognize a gift from the Taipei Economic and Cultural Office in Houston, representing Taiwan. Director General Peter Shin has presented 100,000 medical face masks to the state of Arkansas, and we're appreciative of that. And I believe the Lieutenant Governor accepted those on behalf of the state a little bit earlier today. I'm joined, of course, today by Secretary Nate Smith, and also Director Mike Preston will be able to give us an update on some of the things in the Department of Commerce. In terms of the cases today, yesterday we had 4,236 cases in Arkansas of COVID-19. We have an additional 130 cases today. That brings us to 4,366 cases. In terms of hospitalizations, we've had an increase of 5. That gives us 69 currently in the hospital. We've had 1 additional death, and we're at 98 deaths here in Arkansas. Yesterday, we were able to do 1,991 tests, almost 2,000, and we had a 2.6% positivity rate, which is good for where we are. If you remember, the CDC standard, or where the hope is that we will be below 10%. Yesterday, we were at 2.6%. If you go to the chart graphs, you can see the number of new cases, and where we are in yesterday's was a little bit over 130 cases that we had. And you can see the white marking that we only had 17 in the prison systems, and the rest were in the community. I know that you ask, well, where do they come from? Union County had 21, Craighead County 14, Pulaski 13, Jefferson 11, 10 in Sharp County, and the rest were scattered around the state in small numbers. But those are and so you can see that they're not all congregated in one with 70 cases. They are scattered in different counties across the state. Go to the next slide, you'll see the trend line. And where we had our peak in April, we're trending up there. We'll see where it goes the next few days. And the next one is the number of hospitalized. And as you all know, as you increase testing, it's natural that the number of cases increase in the state of Arkansas, because we just simply understand them more. Hospitalizations, we've always said, is something that is a more steady, reliable factor in terms of where we are, and we'll continue to watch that. We've had 2 days of increase, even though was preceded by a number of days of decline in hospitalizations. We'll continue to watch that trend to see where that goes. The next one is the number of active cases in Arkansas, which is also an important indicator, and that has gone up for the last couple of days. We'll continue to watch that. The next slide, and let me pause for just a second on this. I'm going to come back to that so you get to see that, all those colors there for a moment. But in terms of our testing that we've been continuing to emphasize, I mentioned that testing is our radar, our early warning system of a new virus attack. Walmart, I'm pleased to announce, have increased their testing sites in Arkansas. They did have it in Bentonville, Little Rock, and Fort Smith, and they are now adding 4 more testing sites, which is West Memphis, Jonesboro, Hot Springs, and Texarkana. And so this enhances our radar system in Arkansas to give us information that we need. And that brings me, after you see the early warning system with our testing, then it goes to our case tracking system, which is our most effective defense and limits the spread. These work in combination, and I mentioned the other day that I wanted to look at the 64 new cases last Saturday. And I asked Dr. Smith and his team to give us an insight as to what happens to those 64 cases. And let me just show you the pattern as to where they go. You have a new case. Of course, in this case, it was 64 new cases. Each one of those is interviewed by a nurse that will tell that individual who's tested positive, you need to isolate, you need to quarantine yourself, and that you need to take care of yourself, watch your symptoms, and that you will be contacted by a contact person that will interview you about all the other contacts that you might have had that we need to be in touch with. And that then goes to the contact tracer, who calls the person to get a list of contacts, and then the contact tracer calls those contacts, and in each instance will be telling them that they either need to be isolated for 14 days. If they're symptomatic, they need to get tested, and they're all enrolled in our software system. It's called SARA, or SARA Alert System, but that is a software system that is managed that keeps an eye on all of the individuals that have been contacted or identified as someone that may have been exposed to COVID-19. And then you can see at the end, if you have contacts with no symptoms, they're quarantined for 14 days. If there's contacts with symptoms, they're instructed to get tested. So that's the pattern that's followed. And then if you go to the next slide, you'll see where these 64 cases that happened last Saturday are located. And you can see on this particular day, we had, it looks like 15 in Pulaski County. We had, 9 in St. Francis County. Benton County had 6. And then, you know, there's the onesie-twosies, as Dr. Smith says. We had 2 in Sevier County, 1 in Ouachita County, 3 in Union County, and they're really scattered around the state. But that gives us an idea of those 64 cases, where they are in Arkansas, whether it represents just simply a small exposure or whether it is the potential outbreak that we all worry about. And then if you go to the next slide, you'll see again a breakdown of these 64. It's 64 cases. We had 49 was a successful contact, and we started that sequence that I just outlined. 1 of them was deceased, 1 was hospitalized, which means there's really not any follow-up to do except for who they might have been exposed and need to contact. Nursing home resident, an out-of-state resident was 2, and then there's 2 of them still working to contact. Now, let me emphasize right here what's important about that everybody understands what this means. That means this was last Saturday, and we still have 2 people that might have been exposed to COVID-19 that we have not been able to contact yet. Now, you think, well, that should be easy. Why don't you just go knock on their door? Well, if you knock on their door, they may or may not answer, but it also leads to additional exposures, and so we try to do this remotely and by telephone. And, you know, they could be traveling, which is of a concern, or they might not be answering, but we need everyone to be responsive to the Department of Health if they call, and to cooperate in terms of if you've tested positive, who you've been in contact with, and this knowledge helps us to make sure we limit the exposure, but also helps to protect the individual, to make sure that they get the care and treatment they need, and that they don't expose family and loved ones that they care about. And so help us out if you're contacted by the Department of Health. And so with that, as I said, case tracking is our most effective defense and limits the spread, and that's what we're continuing to work on. With that, Dr. Smith.
Thank you, Governor.
want to give a few more details on the numbers. Again, we have had 130 new cases since yesterday. 17 of those were in correctional facilities. 113 were community cases. Our total then is 4,366. Of those, 928 are considered active cases. Of those 928 active cases, 305 are in correctional facilities, 101 are in nursing homes, and 522 are in the community. We have 69 who are currently hospitalized. That's a net increase of 5 from yesterday. As the governor said, this is our second day of increase in the number of hospitalized. We have 10 currently on a ventilator. That's a net decrease of 3 from yesterday, and we have a total of 98 deaths. So we have had 1 additional death from yesterday. We have 3,340 who have recovered. That's an increase of 63 from yesterday. As a brief update on our nursing homes, we have 51 nursing homes that we are currently following with either 1 or more cases amongst the residents or the staff. We have had 3 new staff test positive, so we're at a total of 179 staff. I want to give a brief update on the Randall Williams facility in Pine Bluff. Based on our testing there, we had completed the testing in the building that we were testing in, but we've decided to extend that testing to other buildings within that unit, so there's more testing going on at that facility. I also wanted to mention that this morning I had the opportunity to go and visit the PPE decontamination unit that we have at the Goodwill Industries site, and this is using the Battelle processing system. They use aerosolized or gaseous hydrogen peroxide to decontaminate N95 masks, and that's a resource that's available to all providers in the state, and it's free of cost. It's a great system. These N95 masks can be decontaminated and reused up to 20 times. And so that really can extend the supply of the N95 masks. And all that providers have to do is call in, set up a contract, a free contract, because it's at no cost to the providers. And then they send their masks in by FedEx. It's prepaid, and then they'll get those masks back in 24 to 72 hours. So this is a great resource. We just need to use it. And Director A.J. Gary was there with me as well. So I'm hopeful that will be a way that we can decrease the shortages of PPE in our state. The governor talked about the counties where these new 113 community cases came from, and I just want to mention, if you're someone living in one of those counties, you know, be on the lookout. You have there is COVID-19 circulating in your community. This is the time to be careful. Maybe don't have a party, big party at your house. Wear a mask when you're out in public. Practice good hand hygiene. If you're a provider in one of those counties, it's maybe a good time to increase your testing. We want to find all the cases, not just some. And anyone who's in our state, but especially those in these counties, if you have symptoms or you've been in contact with someone who's a known or suspected case, go in and get tested. And just to go over those again, Union County, 21. We had 14 in Craighead County. We had 13 in Pulaski County, 12 in Washington County, 11 in Jefferson County, and 10 in Sharp County. St. Francis County, we didn't have as many. We only had 6 there. The last thing I wanted to talk about is a little bit about the case investigation, contact tracing. Talked about the testing yesterday. It's this follow-up on those positive tests, the case investigation, the contact tracing that's so important. It's time-consuming. Each of those cases is a little bit like a detective work. But this is really how we can alert people that they've either been infected or that they've been in contact, and how we can reduce the transmission. As the governor said, it's really important that we work together on this. If the health department is trying to contact you, please return those calls. If your provider has told you that you've tested positive, please isolate at home until you hear from the health department. And if someone tells you that they've tested positive, you've been in contact with them, we'll arrange to get tested, but then quarantine at home for 14 days. With that, I'm going to close and turn it back over to the governor.
Thank you, Dr. Smith, and I want to recognize Secretary Mike Preston, Secretary of Commerce, who has worked very closely with our workforce services and the Department of Finance in putting out and getting our system ready for the pandemic unemployment assistance, and I wanted him to give an update.
Thank you, Governor. Good afternoon, everyone. I do wanted to get an update and just kind of address some of the questions that we continue to hear and make sure that this information is readily available. So right off the top, we do get a lot of questions about the trust fund for unemployment insurance and what financial condition is that trust fund in. We currently stand at $778 million in our trust fund. We're actually capped at $1 billion. Which we had anticipated hitting this year, but for the pandemic. So right now the trust fund is in a good situation and good standing, but we'll continue to monitor that very closely as it relates to the number of claims coming in and how long this goes with the number of people on unemployment. To put it in perspective in terms of the payments that are going out, and I know we get a lot of questions about people who are filing or might be going through somewhere in the process, but to show that the funds are moving, right now since this pandemic has started, we have made payments to the tune of $109 million from our state trust fund. From the federal pandemic unemployment compensation, this was the additional $600 provided for in the CARES Act. We provided payments to the tune of $248 million throughout the state. And then the pandemic emergency unemployment compensation, again, this was part of the CARES Act. This was the additional 13 weeks for those who had exhausted their funds. We've sent out about $500,000 in that. So all total, about $357.9 million has been paid to date through our unemployment assistance programs. So I wanted to share that information with you to show that funds are getting out there, hopefully getting to the people who are in desperate need of them. As it relates to the pandemic unemployment assistance, we currently stand at about 30,000 applications since last week when we opened that system up. An email did go out to all the pandemic unemployment applicants last week talking about the process and how we move forward. And barring any unforeseen issues or glitches, we indicated in that email we hope to have payments available sometime in that week of May 18th. I know we're working very closely right now on the certification and the payment process of this. Obviously, a lot of testing will go into that as we're dealing with banking account information and routing information, and we want to make sure that site and system is secure as possible. We obviously don't want to expose ourselves to any additional fraud if we don't have to. And certainly in times like this, we want to have a system that is secure and make sure that anyone who is trying to file a fraudulent claim, that we'll be able to identify that up front so it's not doing a payment and then we have to left in a situation where we're going in and trying to claw back funds. So therefore the stringent testing on the front end should help us on the back side. But again, as that email alluded to those 30,000 who have applied about the process, please look for that and go to our website, and we hope sometime, again, barring any unforeseen issues or glitches in the testing, that sometime in that week of May 18th, we'd like to have those payments made available. And then I just conclude, Governor, by thanking the team at DWS and DFNA who have partnered together on this pandemic unemployment assistance system. This will be our new system going forward, and it will work in conjunction with our existing UI system. From the time we got the Department of Labor guidelines in mid-April, our teams have been working around the clock to get the system built and up and running, and it's going to be a system that hopefully we'll all be proud of going forward. But the teams have worked very hard. our teams there at the call center, within the Department of Commerce, the IT, and then our workforce centers around the state who are on the front lines handling these claims and talking to the individuals in person. We really appreciate the effort and hard work and long hours that everyone is putting in. Thank you all for your patience, and Governor, I'd be happy to answer any questions on this.
Thank you, Mike, and we're open for questions.
About the increase in the cases, I think it's 113 from the community. I think that would be a new record for non-prison cases in one day. And so just wondering how concerning that is, and are the cases related to each other at all, or are they all just kind of separate cases? Or?
That's something that we look at, and as I described the different counties, the largest one was 21 in Union County. Of course, we will now engage with our identification, our contact tracing, and we'll learn more, but we're not aware of this reflecting any large outbreak in a community versus simply the fact that we've done more testing, and it's something we want to watch whenever we have, even though our positivity rate is low at 2.6%, we still certainly want to watch that increase that we've seen over the last 2 days.
Governor, as of right now, where are you looking at in terms of when we might go into phase 2?
Dr. Smith and I had a conversation about that before coming in here, and we're not in a position to predict when that might happen. Obviously, when you see 2 days of increase in cases and 2 days of increase in hospitalization, that causes you to pause and say, we've got to make sure that we remind everybody to be careful, not to take this for granted, and not just to assume that we're going to be at phase 2 in 14 days, because we got a lot of work still to do. And so we want to have a few more days still to see if the last 2 days just simply reflect one of those upticks that we start going back in the trend in the right direction, or whether this is a pattern that we need to watch more. So obviously this is not encouraging for a quick movement into phase 2, but we will evaluate it a little Monday. We're not prepared to go into phase 2 next Monday. So in that sense, it does delay us. As to what day that will be, we just have to wait and see. Is there any, go ahead, one more here.
The music venue Temple Live held a press conference this afternoon, and they said things like their rights were being trampled on, they were being treated unfairly. Do you have a response to that?
Well, it's my understanding that they indicated that they're moving the concert from May 15th to May 18th, which means that the concert would fit within our guidelines. And so we're grateful that they determined that they ought to follow the directives and the law and do the right thing for the concert goers, but also for the public in general. And so we're delighted that Monday, assuming that their health plan can be approved by the Department of Health, and there are security measures there, then that concert can proceed, and we're delighted to welcome the concert goers there to that venue. So we are pleased that we have that resolution, and that the concert promoter recognized the need to follow the directives of the Department of Health. Is there a question remotely?
Yes, Jacqueline Froelich with Public Radio, KUAF. I have a question for Dr. Smith.
Okay, sure.
And there's a situation, thank you, Governor, and thank you for your remarks on Friday about the press. I really appreciated that. There's a situation in Eureka Springs where a Cummins parolee arrested according to jail records and booked into the Carroll County Jail for breaching his parole has apparently tested positive for COVID-19 since his release from Cummins. He failed to quarantine himself and is widely circulated in Eureka Springs. He's back in Department of Corrections custody. So 2 questions for you, Dr. Smith. Do you plan to deploy aggressive contact tracing in Eureka which is a tight-knit community, but with a really large transient tourist population that's kind of growing right now. And how can this be prevented from happening again, given inmates are being released from Cummins? Thank you.
Excellent questions. Yes, well aware of this situation, and yes, we will be doing aggressive contact tracing and perhaps even some community testing within that community. So we're taking that situation very seriously, and we will do our best to track down all the contacts of this individual. My understanding is that this individual actually tested positive after being released, had previously tested negative, and that's always a possibility, but we're trying to be very careful with those who are released. There's not possible to 100% prevent something like that. People, even if they're not in the Cummins unit, if they choose to go and expose people, even if they know they're positive, then that's clearly a problem. When we know about that, we will issue an order of isolation if necessary, or if someone's been exposed and they're not abiding by quarantine, an order of quarantine. But this is a very unfortunate situation, and we will do our very best to contact those who have potentially been exposed and to prevent this from happening in the future.
Thank you, Dr.
Let me add, just a second, Alice. Let me add to that that it's important whenever we have a parole violation with the Department of Corrections and we want to take them into custody. Under these circumstances, they should be brought into the Department of Corrections facilities, which were better prepared to manage a COVID positive case versus going to the local county jail, where they might not be as prepared. So that is a instruction that I've given to our Department of Corrections. With that, I think it was Allison that was asking a question.
Yes, thank you, Governor. Along that same line, we talked to the Carroll County Health Office there, and there are people calling who are wanting to be tested because of this potential parolee who they may have come in contact with, but currently the health office there does not have enough test kits to be able to do this testing, and they are working with the health department. When will they be receiving those, and how is the health department addressing this?
Dr. Smith.
We can get those test kits to them very, very quickly. We'll work with anyone who wants to do testing and doesn't have an adequate supply of collection kits, but we'll also be doing testing, I believe, at the health department unit as well. So that should not be a problem that can be resolved by the end of the day.
Is there a protocol for testing inmates before they're released?
Yes, I believe there is.
All inmates, or what is the protocol?
All inmates. It's my understanding that we test all inmates before they're released. And so in this instance, it was a negative test, and then subsequently the inmate tested positive after he was released. Is there another question remotely? All right.
Yeah, this is Richard Tiffany, KPSQ in Fayetteville, and I was wondering if there was plans to test all the inmates who were negative at Cummins, either with the regular test or with the serology test, to see who was missed on the first go-round.
Dr. Smith, did you get that?
Typically what we will do if people have tested negative, we will continue their quarantine. If they've been exposed, if they develop symptoms, we'll go ahead and test. There's really a fairly narrow window, 14 days from exposure, that we have to be concerned about. But what would prompt us to do testing, repeat testing in someone who had tested negative is if there was either a new exposure or if they developed symptoms. Now, as to the antibody tests or serologic tests, it is not recommended by CDC that these be used for clinical purposes at this time because there are false negatives and occasionally false positives. We will be using those as part of what we call a seroprevalence study to look at how many have tested positive in the community, but the performance of those tests is such that it's difficult to interpret for a particular individual. There are certainly cases where an antibody test might be useful in better understanding whether someone has had past COVID-19 infection, but it's not something that we use routinely.
Are there any other questions?
Yes, Governor. Good afternoon, Neil Gledner in Hot Springs. A follow-up for Dr. Smith on the contact tracing. Just to take to the next level, Dr. Smith, so in the chart the Governor showed, there were 49 people contacted as a result of the Saturday numbers. If each of those, for instance, each of those 49 people talked to 5 others, would that mean that the contact tracers would then have to track down another 245 people?
The short answer to that is yes. If there was a significant contact with 5 people, then we'd need to track down all 5 of those. And that's how we do contact investigations. If any of those 5 test positive or develop symptoms and then test positive, then we would do contact tracing on them and we would widen the net. If we can do that quickly enough, we can get ahead of COVID-19 and we can stop the spread in the community, which is exactly what we're trying to do. Now, on average, we have 2.5 contacts for every case. Not every case has contacts within the window of time in which they would have been communicable. And some have many more than 2.5, but on average, we're having about 2.5 contacts per case.
We have a question at the table here. I think I saw. Yes, Andy.
Robert Todd Birmingham, the blue light rapist, died. Is that a COVID-19 case?
That's correct. That's what. Yes.
It was COVID-19.
That's correct. There's one final question remotely.
Hi, Governor. This is Ashley Godwin with THV 11. So we got a question about doctors diagnosing presumptive cases. Maybe a family comes in and only one person is tested, so it's assumed the whole family is positive. Are those cases counted, and do they go through the same ADH contact tracing as a confirmed case?
Did you get that?
There is a criteria for a presumptive case that's been put out by the Council for State and Territorial Epidemiologists, and that can be used for reporting purposes. I would discourage, though, presuming that someone is infected instead of testing them. If it's possible to test them, they should be tested because not everyone who has symptoms consistent with COVID-19 is actually infected, and there's no reason to guess or presume when we have testing available.
Is everybody good? All right. With that, thank you all very much, and very helpful conversation today, and we look forward to seeing everybody tomorrow. Thank you. So, Mike, you're my